Okay, so one thing I wanted to show you, a technique to get some of this connective tissue off, is to take a dry paper towel and sit here and rub the muscles. So when you do this, all the connective tissue and the fat will fray up, while the muscle tissue really doesn't fray up that well. Alright, so now all that connective tissue and fat are fraying, and it gives you something to grab onto with your forceps. And so you can carry on. Alright, so as I was going through the footage, I realized the superficial shoulder muscles didn't come out that great on the camera, so I'm going to redo them. So that's why the other part of the mink is dissected right now, so you could ignore that. So you didn't miss anything. I just had to go back and do these muscles again. But we're going to work on the dorsal side superficial muscles of the shoulder. So I'm working on the right side of the mink right now. So the head of the mink is to the right and the tail of the mink is to the left. Okay, so we're starting with the scapular region, specifically the superficial muscles of the scapular region. And really all we're doing here is cleaning up fat's all this yellow goopy stuff, and looking for borders of muscles. And cleaning up this fat here, I've already found the border of the first muscle that we're going to cover. Alright, so I found this border, I got it off the body, I'm still getting some of the fat off. But this is a giant flat muscle that we all have, and a lot of people like to work this muscle out. This is called your latissimus dorsi, or latissimus dorsi. And you may have been to the gym and have seen a lat pull-down machine. Well, that's the muscle it's working out. Alright, it's this giant wing. Okay, so lat pull-down machine works out the latissimus dorsi. Following the latissimus dorsi up will lead you to the next muscle that we're going to cover, which is a triangular shaped muscle here. So I'm going to go ahead and get the border out. So I'm just using the scissors to get the border out here. Don't want to go too deep because this muscle is actually sitting on top of the latissimus dorsi. Just need to get low enough where I can grab it with the backside of my curved forceps, which I was able to do here. And sometimes if you just tug on it a little bit, you'll see the border comes out nice and easy. Alright, and then sometimes it doesn't, so you might have to put a little bit more work in certain areas. There we go. Alright, so this triangle here is your first of your trapezius muscles. So there's 3 in the mink that you will need to know. You have 1, 2, and then 3 up here. Alright, the first one is called your spinotrapezius. Alright, so it ends about right here. I see the other border. So I'm just going to cut out the border there. Sometimes it helps to pull on the muscle a little bit just so you see where the border is more easily. And then just go ahead. I like to use my scissors closed and kind of just work it out. Almost like you're drawing or outlining something. Okay, so I got the border off there to this next muscle. So this next muscle is another trapezius muscle. And this one is called your acromiotrapezius. Alright, because it goes to the acromion, which is part of your scapula. So your acromion is right here, so this is where this is being attached to, where the name's coming from. So this is your acromiotrapezius. That's right in front of the spinotrapezius. Again, I just got the borders out on all sides. Alright, there's another muscle right here. It's a thin ribbon. It goes under this muscle. I got that border out. And I cleaned up some of the fascia here because this is another muscle that you will need to know. Alright, so moving forward. So spinotrapezius, acromiotrapezius, well then this one over here is your clavotrapezius because it goes to your clavicle on the other side. Alright, so it wraps the whole top part of the shoulder. Alright, so this is going to lead you to the first deltoid. So this is your clavotrapezius. Well, if you follow it down, it looks like it's a long muscle, but actually there's a separation around here around the shoulder that turns into a new muscle. So this is called your clavodeltoid. So clavotrapezius and clavodeltoid almost look like one muscle. It's really, what side of the shoulder are you on? Are you closer to the arm or are you closer to the neck? Alright, next to the clavodeltoid, you're going to see a muscle that's deeper. And there's a lot of fat and fascia that you have to get out of the way. I had to dig this out, but here's that muscle right here. This is your acromiodeltoid. And then right behind the acromiodeltoid, you're going to see this kind of oval-shaped muscle right here. Get the border out. All right, that is your spinodeltoid. So we have these 3 trapezius and 3 deltoids, all with the same prefix: spino, acromio, clavo. Spino, acromio, clavo. All right. So spinotrapezius, acromiotrapezius, clavotrapezius, spinodeltoid, acromiodeltoid, clavodeltoid. And between all of these, you have this extra muscle here that we haven't discussed yet. It's a little ribbon, and it runs underneath the clavotrapezius, as you can see here. It's running up towards the head. This is called your levator scapulae ventralis. All right, your levator scapulae ventralis elevates your scapula. So it's right there in the name. Levator is the same root word as elevate, scapulae because it's attached to the scapula, and ventralis because there are 2 of them. We need to know which one's more ventral. All right, so that is all the muscles of the superficial shoulder that you will need to know. So the next we need to go deeper by cutting and reflecting at the trapezius muscles. All right, just to show you what I'm doing next, I've reflected the spinotrapezius and the acromiotrapezius. So I'm going to reflect them this way. So I cut them by the spinal cord. All right, so when you do that, you're going to see the scapula now. So this is your scapula. And if you hold the arms together, you can pull that scapula away from the vertebrae, and you're going to see a muscle right here in between the scapula and the vertebrae. And it almost looks like pulled pork. This is known as your rhomboides minor. All right, it's a very large muscle. It's very frayed. It looks like pulled pork. There's no other better explanation. But it's holding all the border right here of the scapula to the vertebrae. So if you pull it apart, you'll be able to see that muscle. All right, and then we can see 2 other muscles on top of the scapula. So if you notice right here is the scapular spine, which you should remember from bones. All right, a lot of your trapezius muscles are attached to that scapular spine. All right, so you had to pull off the trapezius from that spine. But the 2 muscles that are right here and right here on each side of the spine are named after the fossas that they're found in. So if you remember, this fossa that's above the spine was your supraspinous fossa. Well, this muscle that's found in that fossa is called your supraspinatus. And then on this side of the spine, we had our infraspinous fossa. So this muscle is going to be your infraspinatus. All right, so there's one more muscle that you need to see that's deeper, but I wanted to show you how I reflected the trapezius muscles before I start cutting into this in case it gets pretty ugly. But there's one more little tiny muscle down here that we need to see, so I'm going to get that out now. It's on the bottom side of the scapula. All right, just to show you, here is my scapula. Here is my rhomboides minor, which is the muscle that's attaching the scapula to the vertebrae. On this side, you can see the scapular spine right here, which makes this the supraspinatus, and this one's the infraspinatus, again named after the fossas that they're found in. And then if you come down here, you're going to see the inferior angle of the scapula. Going this way is a different rhomboid that we're not covering from the angle, going towards the vertebrae. But there's another one, a very tiny one, going from that angle this way. It's very tiny muscle. It might be hard to see on the camera. All right, but this is your teres major. So teres major, infraspinatus, supraspinatus, and then your rhomboides minor. Okay? Okay, so that's all the ones that we're covering here. We're going to go another layer deep now. All right, so this is going to be a 3rd layer deep. Remember, our first superficial layer were all the trapezius muscles that we reflected. Okay, so now I have cut the rhomboids. I cut them about this deep right here and reflected them this way. So here's my rhomboides minor right here. All right, this is the one attaching that to there. So I cut that and reflected it this way to see the last group of muscles that we need to find. I did have to cut a little bit of the latissimus out of the way in order to do this. Alright, so first muscle you should identify is this giant muscle right here, and you can get your finger underneath it. You'll notice that this muscle is between the scapula, where my thumb is, and the rest of the body. Okay? And it's very serrated, or it looks serrated. Alright, that's because there's a lot of different heads on this muscle. Okay, so this muscle is also known as your boxing muscle. So this is your serratus ventralis. All right, serratus because it looks very serrated, and ventralis because it's more ventral than the serratus dorsalis, which we also have. So I'm going to show you that here in a second. But the serratus ventralis is very large, and it's known as your boxing muscle because it kind of brings your arm this way. All right, it brings your arm and scapula, pulling it forward. All right, and again, you can get your finger up underneath that. Now, there's another muscle, though. So here is my serratus ventralis right here. All right, remember you can get your finger up underneath it. But there's another muscle on the inside of the scapula. All right, this last muscle is also named after the fossa that it's found in. All right, so remember this fossa on this side of the scapula is your subscapular fossa. Well, the muscle in here is called your subscapularis. So the muscle that's on the inside of the scapula is subscapularis, and then you have your serratus ventralis, which is this big muscle right here. All right, so since we have a serratus ventralis, we do have a serratus dorsalis, and it's very thin. It's this little piece right here. Be very careful when you're pulling this off. It's held together really tough fascia, so you can easily rip this muscle trying to get through the fascia, because the fascia is actually tougher than the muscle itself. All right, so here's all that fascia I was trying to get off up here, all this opaque stuff. But here is the serratus dorsalis right here. And you need to reflect this downwards to see the rest of the muscles. Alright, so once you reflect the serratus dorsalis downwards, then you're going to see the rest of the muscles. You have 3 rows. You have a bottom row right here. You have a middle row right here, which is a little torn up on mine, so ignore all this right here. This is all supposed to be one muscle right there. And then you have a top row that has 2. You have a muscle here, and then another muscle starting right in front of it. All right, this one comes to a point here, and this one starts at a point right here and comes out this way. All right, this bottom one, that's the lowest one. This is one muscle. If you look closely, it has a little fat deposits on it. This is called your iliocostalis. Ilio because it goes all the way down to your ilium and attaches at your ilium in the hip, and costalis because it goes over the ribs. All right, so iliocostalis. Then one above that, the middle layer, is this very long muscle. It's semi-big. It goes down this way. It goes down the whole length of the body. This is called your longissimus dorsi. All right, longissimus dorsi. Don't get that confused with latissimus dorsi, which was this wing out here. All right, so longissimus dorsi here. And then the top row, you have this one that comes to a point here, and then this one that starts at a point here and goes down this way. The one that's more anterior towards the head is called your splenius. All right, so this one right here is your splenius. Well, the one behind it that starts where the splenius ends is called your spinalis dorsi. All right, so we've covered 3 muscles now with dorsi in the name. We have spinalis dorsi, we have longissimus dorsi, and then we have latissimus dorsi, which is this big wing out here that was more superficial. All right, so the next part of this we're going to do is we're going to come down here and we're going to look at the rest of the longissimus dorsi. Remember, that was the middle one up here. It's going down the whole length of the animal. All right, what we want to do is cut out a window about right here. We got to get through some of this tough fascia right here and maybe even get some of the latissimus dorsi out of the way. But what we're going to do is cut out this window to see the heads of the longissimus dorsi. So how the longissimus dorsi works is that it's one muscle down here, but about right here it forks into 3 heads. You'll have one go this way, one go this way, and one go this way, all next to each other. So we want to see those 3 heads because you will have to be able to identify them, so that's why we're cutting a window down here to see that. Okay, so now I have cut a window out of some of this fascia that's in the back, and I cut some of the latissimus dorsi out of the way too, so I just cut this window. And the reason I did this is to see the heads of the longissimus dorsi. So there are 3 heads in here. There's this one, there's this one, there's this one, and then there's an extra muscle here we'll talk about in a second that's really pretty much attached to the spine. All right, so with these heads, again, all I did was cut this window out, pulled off all the fascia until I saw the borders of the heads, and then used my scissors to cut the borders out. All right. So with these 3 heads, you have 2 lateral and 1 medial. Alright, so the medial one is easy. It's this one right here. This head right here is the medial one because it's closest to the midline, which is going to be the spine here. And then you have two lateral ones off to the sides. Alright, but we need to distinguish one lateral from the other. So the one that's closest to the vertebrae, we call this the upper lateral bundle, while the lower one is your lower lateral bundle. So you have a lower lateral bundle, upper lateral bundle, and medial bundle. By bundle, we just mean heads of the longissimus dorsi. So again, longissimus dorsi is one over down on the anterior side, and as it gets more towards the posterior, it splits into these three heads. And then the last muscle you need to identify down here is this little tiny one, which might be hard to find the borders of because it's very tightly bound to all your vertebrae. Alright, this one is called your multifidus spinae. Multifidus just means multi-heads, has many heads, and it has a head for every vertebrae that you have, so that's where the name's coming from. So multifidus spinae is this little one, then you have your medial bundle, upper lateral bundle, and lower lateral bundle of the longissimus dorsi. Alright, so next we're going to move all the way down to the hips now and go over the muscles of the hips. Okay, so I've cleaned up most of the superficial thoracic now, and I haven't cut yet because I do want to show you some of these borders. Alright, so there's going to be 1, 2, 3, and then a very thin muscle on top of 3, 4 muscles that you need to find the borders of. Alright, so first off, I cut off all the fat that was around here. This led me to my first muscle. I also want to show you sometimes if you pull on the muscle itself, you'll be able to see the border better. Alright, so there is a border right here making up this thin ribbon of a muscle right there. Then we have a big triangular shaped one here. And then you'll see another muscle, it's almost a triangle right here, that's kind of running a different direction than this one. So this one's running this way while this one's running this way. And then on top of this one, you're going to see another thin muscle running the same direction, but you need to find the border and get it out. Alright, so I'm going to go ahead and do that now. Again, you're just going to be using scissors once you find these muscle borders. Another, again, a helpful tool is the probe itself. So sometimes if you take a probe, get it underneath the muscle, you'll be able to find the other border. And once you find the border itself, you can go ahead and cut it out. Then we have, stretching everything out, you can see it better, this border right here. And the border on the other side of that big muscle right here. Let me just clean this up a little bit. Make sure I got everything up separated. Okay, and the last one I'm going to cut out, you'll see the border of it right here and right here. So it's on top of this bigger muscle that we just got out. Okay, so here's that bigger muscle. We have this little band right here that we need to cut out now. Okay, so this muscle was pretty stuck, so what I did was I cut it in half and try to pull it this way and this way, just to make it nice and even. But this is one band going straight across. I just cut it to make it easier to get off with the bigger muscle. Alright, so now that we have all these muscles out, we could talk about these muscles. Okay, so coming down here, you have two muscles that are kind of running the same direction. This first one is a muscle that mink and cat have that humans do not. Alright, This is called your xiphy humerus, and everything you need to know is in the name for where it is. All right, it starts at the xiphoid process of the sternum. That's where the xiphy is coming in. And it goes all the way up to the humerus. All right, if you kept following this muscle, it would go all the way up to the humerus, which is this bone right here. So this is called your xiphy humerus. And then you have a group of muscles called your pectoral muscles. All right, so this one that's right above the xiphy humerus is called your pectoralis minor. All right, your pectoralis minor is smaller in humans than the pectoralis major, but in mink and cat, the minor is actually larger than the major. So this is a bigger one. So pectoralis minor is bigger in mink and cat. All right, then above that we have the pectoralis major right here. All right, so you have your pectoralis major here and here. All right, so this last muscle that I reflected or right here to get out goes from your pectoralis muscles all the way to the forearm. And this is a muscle that only mink and cat have, or quadrupeds really have, and humans don't have this. All right, but you still should know the name of it. Since it's going from the pectoral muscles and then going to the forearm, if you remember the region of the forearm, this muscle becomes easy to remember. This is called your pecto antebrachialis. Remember, your antebrachial region is your forearm. So pecto antebrachialis is a thin ribbon of a muscle that goes all the way there. Now, when we cut out the rest of the pectoralis major right here on the upper border, the more anterior border, we cut it away from this muscle. And this is a muscle we covered last class. This is your clavotrapezius and clavodeltoid. You could follow this around and see that it is the clavotrapezius clavodeltoid. All right, so just keep that in mind that these were connected. However, if you do get it out or get the border out, you'll also see another muscle underneath. And that muscle underneath is actually still your pectoralis minor. Your pectoralis minor is going all the way up here on the mink and cat. So the pectoralis major is actually on top of the pectoralis minor. All right, so one more time. Xiphy humerus, pectoralis minor, pectoralis major, pecto antebrachialis, pectoralis major, pectoralis minor deep, and then clavotrapezius clavodeltoid. Okay, so the next step is to go deeper into the thoracic on the ventral side. And to do that, I'm just going to reflect the pectoral muscles right here at the midline. All right, we're going to reflect them that way. Okay, so I have turned the mink around and I reflected all the pectoralis muscles. Remember, I cut them right here and reflected them this way to get to these deeper muscles. But before I got into them, I wanted to show you what you should expect when you cut the pectoralis muscles out of the way. You're going to see a lot of fat and fascia here that needs to be cleaned up. Also, you're going to see the ulnar nerve right here as well. So if you see the ulnar nerve, you know you're in the right area. All right, so I'm going to pause the video and just go ahead and clean all this up and come back to these muscles. All right, so to clean this up again, all I'm doing is taking off the fat with the backside of my forceps, using a paper towel to rough up any of the connective tissue and peel that off with my fingers or my forceps, and just generally looking for borders of the muscles that are right here. So I'm going to go ahead and pause the video and do that. Okay, so once you clean up all the fat and fascia off of here, this is what you're going to see. Again, here's your ulnar nerve. You're going to see this muscle that has multiple heads that should all be attached right here. Alright, this muscle is a muscle that we covered already when we looked at the dorsal side of this organism. So this is that muscle that separates the scapula from the rest of the body. So this is your serratus ventralis right here, or your boxing muscle. And again, kind of pulls the scapula this way. Alright, so that's your serratus ventralis. Just know you can see it from two different angles, from this angle or from the back side. Alright, so right above the serratus ventralis, you're going to see another muscle. And this one has multiple heads, but you don't need to know every head. You just need to know one head. Alright, so I'm going to outline the head right here. It's almost like a little ray of sunshine coming out from underneath the ulnar nerve here. Alright, this is your scalene muscle, or one of the heads of your scalene muscle. Specifically, this very long head is called your intermediate head. Alright, and that's because we do have a medial and we do have a lateral head that you don't need to know. So just know if you see this, know it's the scalene muscle, and it's specifically the intermediate head of the scalene muscle. Alright, once you're done with that, you're going to start noticing this muscle right here that takes up pretty much the whole side of the organism. We're going to come back to this muscle when we get to the abdominal region, but this is your external oblique. And going back to the intermediate head of the scalene, if you go right above it, you're going to see another muscle that kind of goes down the length of the sternum towards the external oblique. This is called your transverse costarum. So transverse meaning going across, so it goes this way across and then down. And costarum, costa meaning ribs. So going across the ribs is really the name of this muscle. Transverse costarum right here. And it's right next to something called the linea alba, which is a white line that goes down the center of the organism. So I'll talk about that again when we get to the abdominal region. All right, so one more time in here. We got our serratus ventralis. All right, it ends about right here. Then we have this sunshine muscle right here. This is your intermediate head of the scalene. And then you have another muscle going across the ribs towards the midline right here called your transverse costarum. Then you have your external oblique. Now the next muscles we need to cover are just deep to the external oblique, so you might need to cut out a little window right here to see them. So I already started. So I cut out the external oblique, just a little window to see these first muscles. When you see ribs, you know you're in the right area. Okay, so just to show you what I did, I cut out part of the oblique right here, and I reflected a little bit more of it just so I could really have a good field of view. You're going to start seeing... So again, just getting the oblique out of the way. You're going to start seeing the ribs here, and that's when you know you're getting to the next muscle. So if you look closely enough, the muscle that is running between the ribs in this general area is going to be running kind of this way, almost with the ribs. So your ribs come down and then kind of carve inwards this way. Now you have this muscle and the fibers are running this way. So what happens when this muscle contracts? Alright, so you have ribs coming down like this, you have muscles running with it. What happens when this muscle contracts? What's going to happen to the body cavity? Alright, well the body cavity is going to, the thoracic cavity specifically, is going to expand, right? The rib cage is going to open up. Since the ribs are going this way, when they get pulled this way, they open. Alright, so this opening causes inhalation. So this first group of muscles that are kind of running with the ribs are called your external intercostals. External meaning outside, and intercostal meaning between the ribs. So the external intercostals run with the ribs, and when they contract, they open the rib cage. Alright, then you're going to cut another window out in the external intercostals, and you're going to see another layer of muscles deeper, but here the muscle fibers are kind of running perpendicular to the ribs. Alright, so this muscle is covering the whole ribs running perpendicular. So again, here's our ribs, but now we have muscles going this way. What happens when they contract? Well, when those muscles contract, they're going to close the ribs or collapse the ribs. So that's used in exhalation. Alright, so this lower layer is called your internal intercostals. So internal intercostals running against the ribs or perpendicular to the ribs, causing exhalation or collapsion of the thoracic cavity, while the external intercostals are running with the ribs and causing inhalation, because when they contract, they open the rib cage. And all of this was underneath the external oblique that's right here. Alright, so that's all the muscles of the thoracic region that we need to cover. So now we're going to start moving into the abdominal region. But first, I'm going to follow the outline of the external oblique all the way down. So I'm going to do that first because that's the easiest to see. Okay, so now we're cutting down this external oblique. I was just following the edge. Really all I did was find a good spot that I obviously saw the edge, made an incision with my scissors, and then used the probe to work my way down, find the edge again, and keep on cutting. Now, yours might be a little different, but whatever they did to my mink, they sewed it back closed right here, and it kind of bunched everything together. Alright, so just keep that in mind. That's why it looks so funky down here. But I also did it to the other side, so I got the border of the external oblique on this side out too. Now, there's a couple of things that you need to notice here. One, you're not going to be able to see very well because of what they did to my mink. Alright, because it's all bunched up, you can't clearly see the linea alba. Alright, so I just cut where they sewed the animal back together out of the way. You see these sutures right here. I cut those out of the way, and they actually cut down the linea alba to do whatever they're doing inside the abdominal cavity. But down here, you can almost still see it if you keep following it down. There is a line that goes down straight down the middle of the organism. You can even kind of see it in the thoracic region. Alright, and this is the midline, and we call this the linea alba because it's a white line that goes down the center of the organism. Again, this is not the best example because of how they cut it. Alright, they cut it down the linea alba. Alright, so unfortunately you can't really see that right now. Just know that there's a white line that makes up the midline going all the way down the organism. You can see it more in the thoracic area, but it should go all the way down to the pelvis. Alright, so then we also have our external oblique. Alright, external oblique on both sides. Alright, I started getting off this side as well because they sutured it here on the external oblique, so it's, again, hard to see. But underneath the external oblique, you're going to see a group of muscles that make up kind of ribbons that go down the whole length of the organism. So they, again, sutured straight through this, but at least you could see the ribbon right here. Alright, if I kept getting this external oblique out of the way, you could see it more defined. Okay? So this ribbon goes all the way down the length of the organism. Alright, this is called your rectus abdominis. So your rectus abdominis is your ab muscles that everybody likes to work out. So your rectus abdominis is this group of muscles that go straight down the organism. Alright, so abdominis meaning in the abdominal region. Rectus, again, means parallel to. Well, this is called rectus abdominis because it's parallel to the midline. It's abdominal muscles that are parallel to the midline, rectus abdominis. Alright, so that is that ribbon of muscles there. And it's right underneath the external obliques on both sides. So external oblique, external oblique. Okay, so one more thing I wanted to point out before we move any further is to make sure that nobody gets confused between the external oblique, which we just got done doing, that was this one right here, and your latissimus dorsi, which was that wing that's coming off the back. This is the first muscle we covered. Alright, but they're very similar and they're on top of each other. You see the latissimus dorsi, peeled off, is on top of the external oblique, which takes up pretty much the whole side of the body. Okay, so next we're going to move on to the neck muscles. So I need to clean up here. Again, I'm just doing the same thing I have been doing by peeling off any fat or anything, and then using a paper towel to scrub off any of the connective tissue, and all the while using my fingers or my forceps to do so. Okay, so with the neck, I haven't cleaned up that much yet, but there is a lot of dense connective tissue here that you have to get underneath. Again, I know it was connective tissue because if I got my forceps underneath it, I still see the shininess of the metal. Alright, so the muscle itself is not that transparent while other types of tissue are. And so I was just simply getting out of the way, looking for these two muscles right here that make a V that kind of follow the jaw, the mandible. Alright, so once you find those, you can go ahead and get the border out of both of these, and that's as far up here as you need to go. As long as you can see these muscles, you've gone far enough. Also, you want to get some of this connective tissue and some skin, there's still some skin on mine, out of the way to see this muscle off to the side here. This is a nice round muscle. Once you do that, you don't need to cut out the border, just know that muscle's there. Cut out the borders of these two muscles, and then we'll talk about the rest of them that are on this mink. So I'm going to go ahead and do that now. Take my scissors. There is a border right there that I'm going to cut out. Once I get a little bit out of the border, I'm going to go ahead and use my probe and try to get underneath it. Get some of this connective tissue out of the way. Alright. So we got that muscle out, and there's another one on the other side that I kind of already worked out as I was cleaning it up. Alright, then there's two more muscles right here that go straight down that are kind of underneath these muscles that we just got out. Alright, so let's go ahead and talk about the names of these. Alright, so these muscles right here that are following the jaw, they kind of make a V, just like the jaw makes a V. Here's the mandible, here's the muscles right here. These are called your digastrics. All right, so digastrics are the ones that are directly following the mandible. So here's a digastric, I got my probe underneath, here's a digastric. Then underneath the digastric you have two more muscles, which are thin ribbons that are running down the esophagus. Alright, so once you have these out, around here is where you're going to find your hyoid. You probably won't see it, especially on your animal because it's so small, but this is where your hyoid is, that bone that floats in our neck. Alright, well the part of the name of these came from that bone. Okay, these are called your mylohyoids, right here and right here. Mylohyoids, going to the hyoid bone. Then you have two more that go from the hyoid all the way to the sternum. And you probably will have these kind of torn up because a lot of times when they inject the animal with the preservative, they will tear through these muscles. However, I was lucky and still have one left right here. Alright, so this is another muscle. It's almost the same as the mylohyoids, except it's going from the hyoid bone to the sternum. So you should have two of them here. These are called your sternohyoids. So mylohyoids going from the mandible to hyoid, sternohyoids going from hyoid to sternum. Alright, and then you have two muscles coming off the sides of the neck right here and right here. You'll see the separation of this muscle and the clavotrapezius clavodeltoid. Okay. So, this is called your sternomastoid. Alright, going from sternum to the mastoid process that is on your temporal bone. So, sternomastoid. Alright, and then the last muscle that you need to know up here in the neck, in the cervical region, is this round muscle that we got out of the way before. Alright, these are called your masseters. And masseter's root word is the same root word as mastication, which means to chew. Well, these are your jaw muscles right here, your masseters. Alright, so this is helping you chew your food. Alright, so one more rundown. The ones that are directly following the mandible, that I got a probe underneath there, and a probe underneath here, are called digastrics. Underneath that you have two ribbons that are going from the mandible to the hyoid. These are your mylohyoids. Then you have two more going from hyoid to sternum. These are called your sternohyoids. They still have one intact. And then the ones off to the side, they're going from sternum to mastoid process, is your sternomastoids. Alright. And then finally we have our jaw muscles way up here, which are nice and dome shaped. These are your masseters. And that is all the muscles of the cervical region that you will need to know.